Welcome to Registered Nurses Empire. There are 10 practice questions. You have 10 seconds to answer and check rationalization. Good luck. Question number 1. The client with mania is running on the hospital premises and cursing all the people that he sees. Which of the following diversional activity may the nurse offer? 1. Organizing an activity for the patients. 2. Setting up a sports competition. 3. Picking all the trash in the facility. 4. Watching television.
Three, two,
The answer is 3.
1.
Picking all the trash in the facility. Remember, the patient with manic episodes is disruptive and manipulative. Offering an activity that promotes productivity is the best way to divert the negative traits of the patient. Question number 2. A 56-year-old alcoholic patient verbalized that her wife was reprimanding him to stop drinking alcoholic beverages every day. The patient did not agree because alcohol makes his life stress-free. The nurse should evaluate the situation based on what defense mechanism? 1. Denial. 2. Regression. 3. Projection. 4. Rationalization.
Three, two, 1.
The answer is 1. Denial. Remember, denial is a common defense mechanism for alcoholics as a way of escape when they are caught in the act. Question number 3. A new nurse has not been carrying out dressing changes satisfactorily. The nurse manager is aware that she should first use which of the following approaches on the new nurse? 1. Instruct the unit's nurse educator to schedule a class for the unit on the topic. 2. Document the inadequacies in writing and have the new nurse sign the paper. 3. Inform the new nurse that there are deficiencies that must be rectified by a stated deadline. 4. Ask the new nurse how she perceives her performance.
Three, two, 1.
The answer is 4. Ask the new nurse how she perceives her performance. Remember, the first step is to determine how the involved person perceives his or her performance and what would help the individual improve. Question number 4. A client with major depression and psychotic features is scheduled for electroconvulsive therapy, ECT, tomorrow. Which of the following statement of the nurse needs further education? 1. Better to remove all metal objects in your body before the procedure. 2. NPO will be implemented a night before the procedure. 3. Anticonvulsant drugs are acceptable to avoid fever complications post-procedure. 4. Short-term memory loss will be expected after the procedure.
Three, two, 1.
The answer is 3. Anticonvulsant drugs are acceptable to avoid fever complications post-procedure. Remember, electroconvulsive therapy, IECT, is a procedure that induces electric voltage in a therapeutic level to a psychiatric patient to rewire his/her electrical impulse in the brain. Anticonvulsants are contraindicated because it will inhibit the desired effect of the procedure. Question number 5. The client's spouse mentioned during the interview that he is having a hard time taking care of his wife because of an unstable mood. After the conversation with the spouse, which action is most appropriate? 1. Suggest that the spouse should seek HCP advice. 2. Advise the spouse to attend a group therapy. 3. Encourage both the spouse and the patient to share their sentiments. 4. Tell the spouse that it is a normal process related to his wife's condition.
Three, two, 1.
The answer is 3. Encourage both the spouse and the patient to share their sentiments. Remember, encourage the spouse that communication with the partner is the best thing to do to know what's the problem. Question number 6. During disaster planning, which of the following is an example of tertiary prevention? 1. Counseling disaster victims about stress reactions. 2. Implementing biohazard precautions. 3. Instituting disaster drills. 4. Providing routine tetanus immunizations.
3, 2, 1.
The answer is 1. Counseling disaster victims about stress reactions. Remember, tertiary prevention involves reducing the degree and amount of injury, disability, and damage after a disaster or crisis. Primary prevention focuses on preventing the occurrence of a crisis or disaster. Question number 7. The nurse is having rounds in the psychiatric ward. The psychiatrist ordered alprazolam, a benzodiazepine drug, to a patient with generalized anxiety disorder. Which of the following health teaching should the nurse do? 1. Remind the patient to take it with orange juice. 2. Advise the patient to report signs and symptoms or toxicity such as lethargy and respiratory depression. 3. Encourage patient to get up in the bed after taking the medicine to prevent the formation of clot. 4. Stress out the importance of taking the medicine lifetime.
Three, 2, 1.
The answer is 2. Advise the patient to report signs and symptoms of toxicity such as lethargy and respiratory depression. Remember, patients who take benzodiazepines or any drugs that aim to relieve anxiety may cause decreased vital signs if overmedicated. Question number 8. A 34-year-old male client diagnosed with major depression spends most of the day looking at the corner of his room. Which approach by the nurse is therapeutic? 1. Wait for the patient to initiate interaction. 2. Call another nurse in the station and surprise the patient. 3. Knock the door until the patient comes out. 4. Initiate contact with the client frequently.
Three, 2, 1.
The answer is 4. Initiate contact with the client frequently. This is a sign of offering oneself. Question number 9. A 37-year-old client diagnosed as being alcoholic tends to drink more than his limits and doesn't care about his finances. According to theories of development under Erik Erikson, which of the following stages determines that the client may have a problem? 1. Trust versus mistrust. 2. Identity versus role confusion. 3. Intimacy versus isolation. 4. Initiative versus guilt.
3, 2, 1.
The answer is 1. Trust versus mistrust. Remember, during the first stage of psychosocial development, children develop a sense of trust when caregivers provide reliability, care, and affection. A lack of this will lead to mistrust. Question number 10. A 6-year-old female child was seen in the emergency department. Objective cues are the following: vague symptoms, bruises over the head, and unkempt appearance. Which of the following action should the nurse do first? 1. Contact the parents of the child. 2. Report suspicious findings to the local authority. 3. Report to the nursing supervisor. 4. Assess further the child's condition.
Three, 2, 1.
The answer is 2. Report suspicious findings to the local authority. Remember, typical management for suspected abuse is safety, report, and attend physiologic needs of the victim. Aim for the licensed nurse. See you on our next review. Bye.